Good morning, and thank you for watching the April 9th City of Janesville COVID-19 Community Briefing. This briefing is provided Monday through Friday at 8 a.m. My name is Mike Bachmeyer. I'm the Planning Section Chief for today. Next we'll review our incident objectives for this city COVID-19 response. First of all, safeguard the community, including our residents, businesses, and visitors. Deter the spread of COVID-19 within our capabilities, provide essential services for the community, and safeguard City of Janesville employees and preserve our city service power. We'll now hear from our members of the EOC leadership team, starting with our situation leader, Maggie Darr.
Thanks, Mike, and good morning. I'm Maggie Darr, Situation Unit Leader for this event. As of yesterday, Wednesday, April 8th, the Wisconsin Department of Health Services reported that there are 2,756 confirmed positive cases of COVID-19 in the state of Wisconsin. There are 42 confirmed positive cases here in Rock County, and we have had 2 deaths in the county. The city continues to very closely monitor our staffing levels. This is so we can continue to serve even if an outbreak outbreak gets larger in our community and affects our city staff. As of yesterday, we had 18.7% of our staff working from home. That's the highest we've had yet. And obviously, as I've said before, there's many of our service areas that cannot work from home, and so we can appreciate these employees continuing to report to duty and all of the employees for continuing to serve and do their jobs. We continue to monitor closely our personal protective equipment, or PPE levels, both for our frontline staff and for all employees. As you can see, everyone here at City Hall is wearing masks and practicing social distancing. And we continue to keep contact with all of our partners. In particularly, our big push right now is contacting all of the senior living facilities here in the community, all of the churches here in the community, and also we're talking to all of our partners at the school districts, as well as daycares that continue to operate and care for children of essential workers. Thank you.
Thank you, Maggie. Next, we'll hear from Economic Development Coordinator Nancy McDonald.
Good morning, Nancy McDonald, Economic Development Coordinator. Our office has been working hard to sift through the enormous amount of information coming through DC in terms of business assistance. What we want you to know is that we're here for you now and we'll be here for you after this pandemic. If you visit our website at growjanesville.com, you will find a variety of information on programs that can assist businesses that are affected by COVID-19. They include Kiva Loans, which is a new loan program providing up to $15,000 in loans with a 6-month grace period. The Paycheck Protection Program, which provides assistance through an SBA lender for payroll and related expenses. On a side note, if you are having difficulty finding a lender, please give our office a call at 755-3059 and we can assist you. The Economic Injury Disaster Loan Program is also available through the SBA through their website. All of these programs, as well as portions of the CARE Act, have been summarized on our website. If you need assistance, please give us a call again. Additionally, the Small Business Development Center at UW-Whitewater is available to assist. Their number is 262-472-1365. Remember, we are in this together. Thank you.
Thank you, Nancy. Next, we'll hear from Public Information Officer Alan Luckett.
Good morning. If you're interested in receiving important information from the City of Janesville, check often our city's website. You can sign up for press releases there or follow us on Facebook and Twitter. Sign up for the city's press releases at the city's website, which is www.ci.janesville.wi.us, and then /email lists. For COVID-specific information, visit our website /COVID19. And obviously it's on the screen below us here. You'll find links to community resources, our archived briefings that happen daily, as well as our frequently asked questions. CDC information, business recovery information, and much more. The City of Janesville trusts government-sanctioned sites such as the CDC and the Wisconsin Department of Health Services, FEMA, and others. To get trustworthy and up-to-date information, we recommend our residents do the same and visit those sites. If you have questions, please call our city's community support hotline daily from 8 a.m. till 4 p.m. That phone number is 608-373-6027. Please share this information with your family, friends, community groups, social networks, and anyone else who can benefit. Also, we encourage social media users to use our new hashtag, which would be on Twitter, which is hashtag #OnePositiveThing, and also hashtag JanesvilleStrong. Thank you very much.
Thank you, Alan. Next, we'll hear from Finance Administration Section Chief Kelsey Bannock.
Good morning, Kelsey Bannock, Finance and Administration Section Chief. The EOC response team has logged 3,647 hours to date, and we've captured expenditures of $775,935.08. Thank you.
Thank you, Kelsey. Next is Safety Officer Captain Tom Bruner.
Tom Bruner, Safety Officer. Good morning. I just want to continue to emphasize washing your hands frequently with soap and water and reminding the 20-second rule, especially if you have been in public places. It's really important that we take care of those little hand hygiene necessities. When soap and water are not available, please use a hand sanitizer that contains at least 60% alcohol. As always, avoid touching your eyes, nose, mouth with unwashed hands. We should avoid close contact with people who are sick and create space between each other, at least 6 feet when you're outside your home. And you should formulate a plan if someone in your household becomes sick. As far as cloth face masks are concerned, that does not preclude any social distancing. So if you're wearing one, please remind yourself to social distance and understand that the cloth face masks need to be laundered frequently. Again, with workspaces and residences, they should be cleaned frequently using approved EPA cleaners, especially those high-touch surface areas with a higher frequency. Thank you.
Thank you, Captain Bruner. Next, we'll hear from Dr. Jay McNeil. He is Medical Director for the Janesville Fire Department, as well as Emergency Room Physician at Mercy ER.
Thank you. Appreciate the opportunity to be here. First of all, I want to say that I'm incredibly proud of the work that Janesville and the other surrounding communities in Rock County have been doing. We've been planning for this for years. And I know that sounds odd, we've been planning for years for something that just happened in January. But this is what we do all the time behind the scenes, constant planning. You've got a proven military leader here as the city manager of Janesville. We've got a fire chief with lots of extensive disaster background experience. And as medical director, I've got my master's in public health, and I actually started out in preparedness work doing exactly this job. So we've got a good team here. We're doing our best to keep all of ourselves healthy, all of our providers that have exposures. There have been deaths in the county. There have been people that have COVID in the county. That's the reality. So keep in mind that over the next week, we're going to see our peak. We're a little bit behind the rest of the country. So if you're watching the national news, just keep in mind that we can't let our guard down. We've got to keep wearing the mask, social distancing, washing our hands. The hospitals, all of the hospitals in the county have been preparing for this. We've been bumping up our ventilator stores. We've been bumping up our ICU beds, our general medical floors, and our negative pressure capability. So I feel we're in a good position to handle this situation. It's something that can cause a lot of fear. So I want everyone to be cognizant of their mental health as well as the people around them. And keep in mind, we've really isolated a very isolated already group of people. So those of you that have elderly neighbors or grandparents, grandmothers, grandfathers, older people that might be kind of locked in and afraid, if you're calling them once a day, call them twice a day. Keep in contact with those people. This is a really rough time for everyone. Keep your distance. Use other means to talk to them, the phone, FaceTime, whatever technology you can assist with. When we hear about infections that are positive, we muster our resources to try and contain that as best as we possibly can. We're working with the health department, other partners, And this is not a one-person thing. Everybody in the county is working together in a unified command structure that works locally and then through the county and then up through the state to get resources we need. We're in good shape locally for PPE. Our responders have what they need to take care of people. The hospitals are in good shape. In addition to all the planning, we're doing contingency planning if any of our staff members get sick. So while we don't like to operate in this manner because it takes a high emotional toll on everyone and it costs a lot of money to respond to this, we're doing the best we can. And we also need you to help us. And some of the ways you can do that is wear the mask in public, do your social distancing, wash your hands. The other thing is don't call an ambulance unless you really need it. We're busy dealing with the COVID situation and other stuff. So if you can call your primary care physician or do telehealth or any of those options, try not to call an ambulance unless you really need it. And don't go to the emergency departments unless you really need to be there. If you're having chest pain, trouble breathing, severe symptoms. Otherwise, contact your primary care physician or try and do telehealth. If you don't have COVID, it's better to not be exposed to a lot of other people that might have it right now. So keep that in mind. And if you have any questions, you can look at the city resource page. You can look at Mercy, SSM, Beloit Hospital, Edgerton Hospital. Everybody's got resources available. So if you're sitting there and you don't know what to do, just reach out and somebody will either talk to you on the phone or in person if we need to. We're here to help, but again, try and reserve those resources for people that really need them in a crisis moment. Thank you.
Thank you, Dr. McNeil. Next, we'll hear from Incident Commander, Fire Chief Rhodes.
Good morning, everybody, and Dr. McNeil, thanks for the good advice. And so, Rock County, 42 confirmed cases, 2 deaths, really serious stuff. So, which leads me to this weekend is Easter. Traditionally, we have many over for our celebration of Easter, and our families get together. I would just ask that you would refrain from that you would keep it to a very small number of people. We can have some fragile members of our community in a family group that may be exposed to the COVID-19 virus. And so we really got to practice our social distancing through this holiday. And I hope that you are planning to celebrate Easter maybe 2 or 3 months from now. So please keep that in mind. As the doc mentioned, we've got about a week to our peak. And according to the Institute for Health and Evaluation, University of Washington, our peak looks like April 14th. That doesn't mean it's over. We still have to wait another week or so to see if we start to get a downturn in our cases. So there is potentially a light at the end of the tunnel, but keep in mind this can change, and it has changed a lot. If you don't have a face mask, there is a great video on the City of Janesville website. Go to our website. There's a green ribbon up top. Click on that. Go to the midpoint page and click on CDC recommendations for face masks. And Dr. Adams, the United States Surgeon General, demonstrates how easy it is to make a face mask, and I would encourage everybody to do that. If you have a few people over this weekend, which I highly discourage, at least at a minimum, have your face mask on. A good point about mental health, as Dr. McNeil said, we're out of our norm. We have resources on our website too to talk about managing stress, managing a crisis, and I would just urge you to do that. That being said, see a lot of good things going on in the community, a lot of good things. Do that one good thing every day, and you will get through this. And once again, call 608-373-6027 if you need help, if you have any questions. If you can't find how to connect with Mercy or Dr. McNeil or the resources there at any hospital in the community, we'll help you do that. Once again, folks, give each other grace. Thank you so much.
Thank you, Chief Rhodes. Next, we'll hear from City Manager Mark Freitag.
Good morning, City of Janesville employees, City EOC members, and certainly members of the community that are listening in. A couple things to update you on today. First of all, I would like to say thanks to Dr. McNeil for coming in and speaking to our community today. Interestingly enough, a citizen member that watches this briefing every morning contacted us and said, "Hey, it would sure be nice to hear from somebody from the health community and the provider community." And so we reached out to Dr. McNeil. He accepted, and so thank you for coming. And we hope that you'll return and provide some perspective from that health side. And so the message to the community, though, is that if you think that there's a better way for us to do this, if you have other ideas that we should be communicating to the community, please reach out, let us know. You can call us at 608-373-6027 and give us your ideas, and those that we're able to do will certainly implement. The next thing I want to talk about is, kind of what Dr. McNeil and Chief Rhodes have talked about, and that is we've been planning and preparing for such an event, maybe not specifically this pandemic, but for any kind of natural or man-made disaster that might occur in our city of Janesville. And we've been working hard for 5 years, but we're not the only ones. The county's been working it. Our other municipal partners have been working it. Certainly the hospitals have been working it. And so this is just what happens in this world today, and that is that we have to plan, we have to prepare, and be prepared to execute in response to some kind of disaster. And that's certainly what we're dealing with here in this COVID response effort. I would tell you that 2 days ago I mentioned that I gave Chief Rhodes the authorization to go ahead and order a surge shelter. And that prompted some questions, and people asked, well, what's a surge shelter? Well, essentially that's a facility for the hospitals to be able to handle, capacity that they can't handle internally, essentially address that surge in caseload. And so in this case, both hospitals said if they're going to use something, they want to have it on site. And so we've coordinated to have some kind of tent-like structure at each of the facilities, at each of the hospitals here in Janesville. But we're not the only ones doing this. This is happening across the state. Certainly our partners in Beloit are working with the Beloit Health System to provide some kind of surge shelter also. And there are other shelters out there that the county and our partners are working on. There's a thing called an isolation shelter where if somebody doesn't have a home to return to or can't return to a home, where do they go to isolate themselves if they've been confirmed as a COVID-19 case? Likewise, a first responder shelter. Our first responders are out there interacting with the community, perhaps being exposed. Maybe they can't go home to a family because we have a pregnant spouse at the house, or we have somebody in the household that is compromised or in a high risk category. And so we have a first responder shelter, and the city of Beloit has stepped up and said they'd be willing to provide that, and so they're working that. And so it's a team effort, folks. We are working, but these are actions that essentially have to take place, and they provide some kind of relief after the fact. And so I just want to drive home that point, is these are reactive measures. Certainly we're planning for them, we're preparing for them, we're executing them, but they really are after the fact. They're reactionary measures. What we need is we need folks to be proactive, and as I've said, only you can prevent the spread of COVID-19 in our community. And so all of those things we've been talking about, hand washing, social distancing, minimizing your contacts outside the house, that's how we're going to defeat this, and we're going to see the curve flatten out and then essentially diminish. And so again, help us out, heed the advice and the recommendations of our Safer at Home initiatives, and certainly all of the hand washing and physical things that you can do to prevent spread. And so we're going to get through this, but like I said, we're prepared, we're ready, we're executing, and the community is performing quite well. Thank you again.
This has been the April 9th City of Janesville COVID-19 Community Briefing. This briefing is provided Monday through Friday at 8:30 a.m. Thank you for watching.